Hi, this is Dr. Rakshita Shetty, the obstetrician and gynecologist. Today, we are going to speak about the final menses of your life. Yes, you guessed it right. Today's topic is on menopause. Menopause is the end of women's menstrual cycle. The term can describe any of the changes you go through just before or after you stop having your period, marking this the end of your reproductive years. So women are born with all their eggs, which are then stored in their ovaries. The ovaries make the hormones estrogen and progesterone, which control their period. And these eggs get released each month. Menopause happens when the ovaries are no longer releasing an egg every month and menstruation stops. Menopause is a regular part of aging, which usually happens after the age of 45 years. Most women first begin developing menopause symptoms about 4 years before their last period. Symptoms often continue until about 4 years after the woman's last period. There are 3 stages of menopause. The perimenopause, which is the transitional time that starts before menopause. Menopause is the time which starts 12 months after your last menses. Postmenopause refers to the years after menopause, although it can be difficult to know when the menopause finishes and the postmenopause starts. It is important to remember that each woman's experience is highly individual. Some women may experience few or no symptoms of menopause, while others experience multiple physical and psychological symptoms. The extent and severity of symptoms varies significantly among women. The symptoms of menopause are these. Number 1, you can have an irregular vaginal bleeding. Irregular vaginal bleeding may occur as a woman reaches menopause. Menstrual periods may occur more frequently, or they may get farther apart. This will happen just before the menses stop. Secondly, you can have hot flashes. Hot flashes are very common among women undergoing menopause. A hot flash is a feeling of warmth that spread all over your body and is often more pronounced in the head and the chest area. This is sometimes associated with flushing and perspiration. Thirdly, you can have night sweats. Night sweats are episodes of drenching sweats at night time, which can be accompanied by hot flashes. You can have vaginal symptoms. What does that mean? Vaginal symptoms means you can have vaginal dryness, itching or irritation and pain while you're having intercourse. This is because the vaginal lining becomes thin because of the fall in the estrogen level. This can also lead to an increased chance of having a vaginal infection. Obviously, during menopause, you will have a lower fertility. As the female approaches the end of her reproductive years, the estrogen level starts to fall, and that's why there is a reduced chance of becoming pregnant, but there is still a chance. Urinary symptoms. The lining of the urethra, which is the transport tube which leads from the bladder to discharge urine outside, also undergoes changes similar to the tissues of the vagina and become drier, thinner and less elastic with declining estrogen levels. This can lead to an increased risk of urinary tract infection, feeling of the need to urinate more frequently and leakage of urine, which is also known as incontinence. This incontinence can result from a strong, sudden urge to urinate or may occur during straining while coughing, laughing or even lifting heavy objects. You can have emotional and cognitive symptoms like fatigue, memory problem, irritability, rapid changes in your mood. It is difficult to determine exactly which behavioral symptoms are because of the hormonal changes of menopause. What are the other physical changes which you can feel? Many women report some degree of weight gain during their menopause time. The distribution of fat may change, like with the body fat mostly being deposited in your waist and abdominal area, rather than in your hips and your thighs. There could be changes in your skin texture, like wrinkling, development, wrinkles develop, which may worsen with time. Since the body continues to produce small level of male hormone, that is testosterone, women may also experience some extra hair growth on your chin, upper lip or chest. There are increased risk of some health condition. After menopause, the risk of certain health issues appears to increase. Menopause do not cause these conditions, but the hormonal changes involved may play some role. First is osteoporosis, where your bone thins and you're at increased risk of having fractures. You can have cardiovascular disease, like you have high chances of having a heart attack. There is increased chance of breast cancer. Now, there are certain conditions which can cause a menopause early. The conditions involve when you're surgically removing the ovaries. number one. The second one is when you're using chemotherapy or radiotherapy for your cancer treatment. Number third is when you have a premature ovarian failure. So what do you mean by this premature ovarian failure? It means that your ovaries stop functioning before the age of 40 years. And this only occurs in 1% of women. And the cause of this ovarian failure is not understood. So what are the treatment options for menopause? So menopause itself is a normal part of life and it's not a disease which requires treatment. However, treatment of associated symptoms is possible if these become substantial or severe. Number one, you can have the hormonal replacement therapies, also called as the HRT, where you are supplemented with estrogen and progesterone. Other, you can use the vaginal estrogen therapy for your vaginal draining or even the urinary symptoms. Thirdly, antidepressants and other medication for your mood changes. You can use vaginal lubricants. What are the things you can do at home? So there are several ways to reduce the minor to moderate menopausal symptoms naturally using the home remedies, lifestyle changes and some alternative treatments. So what are the at-home tips for managing menopausal symptoms? Number one, keep cool and stay comfortable. So dressing in loose, layered clothing, especially during the night time and during warm and unpredictable weather. This can help you manage the hot flashes, keep your bedroom cool and avoid taking heavy blankets at night so that it can reduce the chances of having night sweats. Consider using some waterproof sheet under your bedding to protect your mattress. Exercising and managing your weight. Reduce your daily calorie intake by 400 to 600 calories to help to manage your weight. It is also important to have moderate exercise for 20 to 30 minutes a day. This can help to increase energy, promote a better night's sleep, improve mood, and promote your general well-being. It is important to communicate your needs. Talk to a therapist, a psychologist about any feeling of depression, anxiety, sadness, isolation, or not able to sleep, any identity changes. You can also talk to your family members regarding this. It is important to supplement your diet. Take calcium, vitamin D, magnesium supplements to help reduce the risk of osteoporosis and improve the energy levels and sleep. It is important to talk to your doctor about the supplements which can help you for your individual health needs. It is important to practice relaxation techniques. Yoga, meditation are very helpful during menopause. It's very important to take care of your skin. Apply moisturizers daily to reduce the skin dryness. You should also avoid excessive bathing or swimming, which can dry out and irritate your skin. It is important to quit smoking and also limit the alcohol use. Some limited studies have supported the use of herbal remedies for menopausal symptoms caused by estrogen deficiency. There are natural supplements and nutrients that may help to limit certain menopausal symptoms, which are number one is soy, other is vitamin E using isoflavone and flax seeds.